Welcome to the PD Pet Care Vlogs. I'm Dr. Cath Watson, and today I'd like to run you through some research that Healthy Pets New Zealand has funded. In this case, it is pre-surgical hand preparation in veterinary practice. Now, this is not physical research that was undertaken by the researcher, but rather a review of research undertaken by others. And the really interesting thing about this is that it's pulled together a whole bunch of information, not only regarding veterinary practice, but also human health practices and whether that's relevant to veterinary practice. It was undertaken by Dr. Kat Cross as part of a state-of-the-art journal article for the New Zealand Veterinary Journal, and we've really appreciated the work that she's put into this article, into this review, because it helps, I think, all of us identify some really good practices when it comes to hand preparation, but also some of the stuff we probably need to be more mindful of. So the review article covers not only the preparations we might use for pre-surgical scrubs, so chlorhexidine, povidone, iodine, but also the alcohol gel-based scrubs. But it's also a really good review of facilities, hand health, and other factors like wearing gloves, whether jewellery is important. So the whole picture is as to how we can manage best practice pre-surgical scrubbing in a veterinary situation. So there is some extrapolation from human health, but the conclusion of this review was that most of it's actually very appropriate for veterinary practice, but we do have some other considerations that are not relevant in human health practice. So rather than take you through the entire review, I thought I'd pick out some of the tips from it that I found really either interesting or really useful. So the first one of those is that actually the patient flora is more important than the human flora. Although with the bugs that are on our skin, we can talk about the resident flora and the transient flora, and we're really concerned about transferring particularly drug-resistant bugs to our patients. Actually, the bugs that are on their skin are still more important than the bugs that might be left on our skin. So preparing your patient is also obviously really, really important. So number 2 take home for me was that actually your hand health is really important. So that's the condition of your skin. So dry skin, damaged skin, much more likely to carry more contaminants. So that's a higher risk. So keeping the condition of the skin of your hands and nails healthy is really important. Interestingly, when it came to nail polish and wearing jewellery, there's not actually a huge amount of evidence that there's a risk there. There absolutely is an increased risk when it comes to using false nails, that sort of thing. But the general recommendation was that we don't really know enough, so for now it is better to avoid all of those things. One thing I found really interesting was aerators and taps. So it's definitely been shown in the human health situation that having an aerator in your tap, so that makes the water more bubbly and so on, increases the risk for Pseudomonas infections. So if you have aerators in your taps, best thing you can do is remove them. When it comes to gloves, obviously they feel like, certainly to me, that it gives you an added layer of protection, but really importantly, you don't rely on them. So when it came to veterinary practices and glove contamination, around 30% of gloves end up contaminated. That's pretty high. As a lower percentage end up with penetration, so holes, but irrespective, we just need to be really mindful that gloves are not the solution or the cover-up to everything. We need to be really careful how we manage ourselves with wearing gloves as well. One other, I think, really important factor that came out of this is that clients expect that we are doing the same as our human counterparts. So they expect that we are wearing gloves and gowns and caps and masks. Maybe a little more debatable about the shoe covers, but if our clients are expecting that, how would they feel if they discovered that actually we weren't? Probably the biggest take home for me, having read this article, was understanding what the word scrub means. Because I think in veterinary practice we've largely assumed that means scrubbing with a scrubbing brush. So really getting stuck in there, getting under the nails, giving our hands a really good scrub. And I, for one, have relatively sensitive skin and know that by using a scrubbing brush, I end up doing my skin quite a lot of damage. So the really interesting thing out of this is that scrubbing actually has never referred to, well, I shouldn't say never, but it's a very long time ago that they've ruled out using scrubbing brushes for scrubbing. Actually just using your hands together or a sponge, because anything firmer than that is actually going to traumatise your skin, and then you're much more likely to obviously damage your hand health, but also end up with more transient flora that have got bigger potential to cause problems. So when you're scrubbing, whatever you're using, whether it's chlorhexidine, povidone iodine, or the alcohol gels, make sure that actually you are gentle to your skin. You want to get the entire service. You still need to take the time to do it properly and thoroughly, but you do not need to damage yourself in the process of doing it. And then finally, the overall recommendation from this review was that actually alcohol gel scrubs are recommended for veterinary practice, but you do need to let them dry. So they had added benefits over and above chlorhexidine and povidone iodine, particularly with their ability to last much longer. But also obviously they're simple to use, and in the veterinary context we can use them out in the field, and where facilities aren't always ideal, or maybe in many cases are not ideal. So a few take-home messages from there. Thoroughly recommend going to the Healthy Pets website, to our research and completed projects, and you can review the full paper there along with all the other research that we have funded to date.